Now we will learn medulla oblongata. It is the caudal most part of the brainstem. Brainstem is made up of midbrain, pons and medulla oblongata. So this is the medulla oblongata. This is the ventral aspect, and on the dorsal aspect, this is the cerebellum. And medulla oblongata, it is developed from the myelencephalon. If we look at the ventral surface, it starts from the pontomedullary junction and up to the, this is the foramen magnum. Okay. Now it is divided by the anterior median fissure. Then comes the anterolateral sulcus and posterolateral sulcus. Here again anterolateral, this is posterolateral sulcus, and after that this is the inferior cerebellar peduncle. Here is also the inferior cerebellar peduncle which connects the medulla oblongata with the cerebellum. And this part comes laterally. If we look at the spinal cord, as this is the continuation with anterior median fissure here, anterolateral sulcus here, and the posterolateral sulcus goes posteriorly. But on the medulla oblongata, both the sulcus, that is the anterolateral and the posterolateral sulcus, faces ventrally. Okay. Now in between the pons and pyramid, this is pyramid and this is olive. Pyramid lies in between the anterior median fissure and the anterolateral sulcus. It is created by the corticospinal fiber underneath, and the olive is formed by the inferior olivary nucleus beneath. Okay. In between the pons and the pyramid, here lies the sixth nerve nucleus, sixth cranial nerve is coming out from here, and this is seventh in between the pons and olive. Now here is the eighth in between the inferior cerebellar peduncle and the pons, and on the posterolateral sulcus, this is 6th, 7th, 8th, there is the 9th, 10th, 11th. Now anterolateral sulcus, there are few rootlets of 12th, and then C1. And from the here the spinal root of the accessory nerve, and then it forms the 6, 7, 8, 9, 10, 11, and this is 12, and this is C1. Okay. So this is the view of the ventral aspect. If we and here inferior cerebellar peduncle, I can divide it into the restiform body and the juxtarestiform body. This is ventromedial portion and it is somewhat dorsolateral. Okay. Now coming to the dorsal aspect, what we see in the dorsolateral aspect, there is open part of the medulla oblongata and there is closed part of the medulla oblongata. Okay. Above there is open part and below there is closed part. This is anterior median fissure, this one. Okay, is anterior, this is posterior median sulcus, because this is the dorsal aspect, posterior median sulcus. Okay. And this is the tubercle. Here is the elevation, and this is called the gracile tubercle. Here is the cuneate tubercle, and this is tuber cinereum. Tuber cinereum. Gracile tubercle is due to the nucleus gracilis beneath, and here is the nucleus cuneatus beneath, and here lies the spinal nucleus of trigeminal. Now when we look at the open part of the medulla oblongata, what we see here is the intermediate zone at first, which is characterized by the presence of a stria medullaris, which is the contralateral fiber going to the cerebellum from the arcuate nucleus. These are the contralateral fiber. Okay. Now after that, here is the median sulcus. Afterward, there is an elevation that is called the median eminence, and after that there is again a sulcus, that is called the sulcus limitans. Here is also sulcus limitans, which after taking half of this course, the lower triangle, it come medially towards the median axis and unite with this median sulcus. Okay, again here this one is the median sulcus and this is sulcus limitans. Here is the median sulcus and this is the here is the sulcus limitans. Okay, and it becomes medial. So here lies the hypoglossal triangle and here is the vagal triangle. Again there is an oblique line crosses the hypoglossal triangle and divides it into the hypoglossal area, and this is the perihypoglossal complex. Okay, medially hypoglossal area and this is perihypoglossal complex. This hypoglossal triangle, it lies over the hypoglossal area, lies over the hypoglossal nucleus, which supply the general somatic efferent to the tongue musculature, skeletal muscle of the tongue, and here lies the perihypoglossal complex. Perihypoglossal complex that is made over the three nucleus sip. यहाँ पे टंग की बात हो रही है ना, हाइपोग्लोसल डेट इज गोइंग टू द टंग, तो हम लोग टंग से ही किसी चीज़ को ऐसे सुरखते हैं, तो सिप, इस तरह से हम लोग याद रख सकते हैं. तो डेट इज अगेन यहाँ पे टंग वाली बात आ जा रही है. सबलिंगुअल न्यूक्लियस, दिस इज न्यूक्लियस intercalatus, nucleus intercalatus, and this is nucleus prepositus, SIP, and this is responsible for the vestibulo-ocular reflex. Vestibulo-ocular reflex क्या है? When we turn our head towards one side, then the opposite side eyeball will move with the same degree in order to fix the gaze. This is called the vestibulo-ocular reflex, which is done by this perihypoglossal complex beneath. Okay, now this is the vagal triangle. Again it is divided into two areas by the funiculus separations. Okay, here lies this medially underneath lies dorsal nucleus of vagus, and laterally beneath the funiculus separations here lies the nucleus tractus solitarius. Dorsal nucleus of vagus, it gives general visceral efferent to the smooth muscle and gland, whereas the nucleus tractus solitarius, it receives special visceral afferent, that is the taste fiber from the tongue, and from anteroposteriorly it is 7th, 9th and then 10th. It is the combined nucleus for the 7th, 9th and 10th, receiving special visceral afferent fiber. Now after that the area is formed by the area prostrema, which is a vomiting center. It lies over the chemoreceptor trigger zone, which is intimately connected with the autonomic center. So if there is in the CSF some nauseating substance, there will be reverse peristalsis, and which lead to the vomiting. Okay, now there is again, it is restricted, and this is the vestibular area where lies the vestibular nucleus, and this is inferolateral boundary. It is formed by the some white fiber, that is the called tinea. This is called tinea. Okay, and this inferomedian angle, it is characterized by the presence of obex. Obex is nothing but the connecting link between the fourth ventricle and the central canal of the spinal cord. One thing I forgot to mention here, this is anterior median fissure, and at this level in the pontomedullary junction there lies a somewhat triangular depression which is called the foramen caecum. Okay, so coming to here, and this is a obex. Okay, and this whole of this structure is just looking like a nib of a pen up to this much, and this is called the calamus scriptorius. Okay, now coming to the section of the medulla oblongata. If we took the section, here is the pyramidal decussation. So at the level of the pyramidal decussation, at the middle part of the medulla oblongata, that is at the level of sensory decussation, and in the upper part, this is at the level of the olive. Okay, so 3 sections we are taking. This is 1, this is 2, and here is the 3. Okay, now coming to first, this is more or less very much similar to the spinal cord. Here this is the posterior median sulcus, and here lies, it is in the posterior funiculus. There is the posterior horn is like this, suppose, and this is like the posterior horn, and in the posterior funiculus this gray matter is going inside the funiculus, penetrating, and anteriorly this is like this. Okay, and this is our central canal. Now what we see at the level of the pyramidal decussation or the great motor decussation. Here lies the anterior spinocerebellar, posterior spinocerebellar, anterior spinocerebellar, posterior spinocerebellar. This is the lateral spinothalamic tract, Here is the corticospinal, and this is our pyramidal decussation. Here also the pyramidal decussation is there. So what is the difference here with the spinal cord? Suppose this is the spinal cord. What we are seeing, what is the difference in between these two? This is the posterior funiculus, where is the from the posterior part, this somewhat the gray matter is penetrating inside the funiculus. This is nothing but this is nucleus gracilis, and this is nucleus cuneatus. Okay, and here is this is the spinal nucleus of trigeminal. This is the tract of trigeminal. Okay, this is central canal, and this is the pyramidal decussation. The fiber are landing here, going posteriorly. Okay, going posteriorly, and with this antero-posterior crossing, this lead to separation from here, and these fiber are crossing, so there are white matter as well as the gray matter. This leads to the formation of the reticular formation of this region. Okay, so what is this? This is reticular formation, and this big part of the anterior horn, it gets separated from the rest of the area, and this will lead to the formation of a supraspinal nucleus of C1 and the spinal nucleus of accessory nerve. Okay, and this is the central canal. This is anterior spinocerebellar, posterior spinocerebellar, likewise in the spinal cord, and this is lateral spinothalamic. Here is the corticosternal. Rest all are same. Okay, now coming to at the level of the sensory decussation, what we see, that this is the posterior median sulcus, and this is they are forming this nucleus gets separated, and here is the spinal nucleus of trigeminal also. This is the tract of trigeminal, and here this medial lemniscal system going like this, and this going after forming the internal arcuate fiber. This is internal arcuate fiber, and this is the nucleus gracilis, and this is nucleus cuneatus. Okay, and this is our, here is the central canal is somewhat dilated, and here lies the 3 nucleus. Okay, 1 2 3, and what we see above, there is pyramid. Here is the upper pyramid. This is the site of the arcuate nucleus, and here is the olivary nucleus. Here is also anterior spinocerebellar and the posterior. This is anterior and the posterior. So here the anterior spinocerebellar, posterior spinocerebellar, the lateral spinothalamic. Okay, so what we see at the level of the sensory decussation, the main events what is occurring is that these fiber are coming anteriorly. This fiber coming anteriorly and decussating to form the sense. This is called the great sensory decussation, and forms the medial lemniscus. Okay, and here is the also medial longitudinal fasciculus is there. Medial longitudinal fasciculus, and this central canal, and these are the nucleus. That here is the TDH. This is the nucleus tractus solitarius. And this is dorsal nucleus of vagus, and this is hypoglossal nucleus. TDH, tall, dark, and handsome. Okay, this is pyramid. That is the pyramid is formed. I mean, a pyramid is due to the corticospinal fiber, no? And here it is landing at the great motor decussation is there. So this is our arcuate nucleus, and behind the nucleus cuneatus there is accessory cuneate nucleus, which is going to the cerebellum, forming the posterior external arcuate fiber. This is going externally, no? And posterior aspect, so posterior external arcuate fiber, and this is, they are going contralateral arcuate nucleus, and this is forming the anterior external arcuate fiber. Okay, and this is called the internal arcuate fiber. Okay, and why this is going opposite side? Because this is actually the inferiorly displaced pontine nucleus, and pontine nucleus forming the pontocerebellar tract, cortico-pontocerebellar tract, going to the opposite side. That's why arcuate is nothing but the pontine nuclei, so they are also going opposite side. Okay, and this is going same side, cuneo-cerebellum. And this is inferior olivary. Here is the medial longitudinal fasciculus, which connect the 3, 4, 6 vestibular, accessory, facial. So just now coming to the at the level of olive, what will happen? Here is again the pyramid. Here is the arcuate nucleus. Now this has spread over here. This is the open part of the medulla oblongata. 1 2 3, 1 2 3. This is from lateral to medial. TDH, tall, dark, handsome. Nucleus tractus solitarius, dorsal nucleus of vagus, and this is hypoglossal nucleus. Okay, now this is at the section of olive, so we have to make olive here. Inferior olivary nucleus. Okay, here is the medial longitudinal fasciculus, and below that there is tectospinal tract. Okay, and here is also this one, spinal nucleus up to trigeminal, as well as its tract. Okay, now from as this is the site for the one thing I would like to say, that from the midbrain, two cranial nerve is coming out, that is the third and fourth. Fourth is coming from the dorsal aspect, third and fourth. And from the pons, 5, 6, 7, 8 nucleus lies. Nucleus, I am talking about the nucleus. And here lies the 9th, 10th, 11th and 12th. Okay. So, and this label, what we are seeing, and this here is also in front of dorsal nucleus vagus. This is the nucleus ambiguous. Nucleus ambiguous, and dorsal. Here is the site. This is the hypoglossal nucleus. It is going from this side here, in between the pyramid and olive. This hypoglossal nerve is going out, and this is the dorsal nucleus of vagus. This is the site of the vagus nerve, and vagus nerve, it contains many more components. That is also from the nucleus tractus solitarius, because its supply is carry the test fiber from the posterior most aspect of the tongue. And dorsal nucleus of vagus going to general visceral afferent, going to the smooth muscle and gland. And this is the nucleus ambiguous, and this is the spinal nucleus of trigeminal. All these are forming the vagus nerve. This one, this one, this one, as well as the nucleus tractus solitarius. This all form the vagus nerve. We have to make 4 here. Okay, and here is like the inferior vestibular nuclei. Rest are in at the level of the pons. Here is the inferior cerebellar peduncle. Okay, so this is all about the sections that we have to write down here at the level of olive. And this is the arcuate nucleus, this is pyramid, this is olive. So this is all about the, we have to we have no time to discuss all this, so we have to make in the exam the sections and just label that thing, and how it is formed. That is the accessory cuneate, posterior external arcuate, anterior external arcuate, and the internal arcuate, and what give rise to this after the, and here also we have to make the reticular formation, and here also reticular formation. So this is all about. Thank you. This nucleus tractus solitarius, TDH, this is the composite nucleus for the 7, 9 and 10. Where is the nucleus ambiguous? It is the composite nucleus for the 9, 10, 11. Going to the spatial viscera, that is the pharyngeal arches, spatial visceral efferent, going to the skeletal muscle derived from the pharyngeal arches.